Hi, this is Ashley again with On-Site Solutions Physical Therapy, and today I wanted to talk about return to running and running without leaking. So this is unfortunately common in that postpartum population and sometimes prevents people from returning to this type of activity, which is the last thing that we want to hear. We want to help people do the things they love, and sometimes running is one of the easiest things to do to stay active. So there's a few tips that we can do in the moment that can sometimes reduce those symptoms. One of them being, so a lot of us run with this upright posture, keeping that chest up and almost pulling ourselves backwards when we're running, where ideally what we want to do instead is have more of a forward lean when we're running. It helps with our trunk rotation. It also changes the forces of the gravity when we're running. So if we have this really upright posture, the pelvis is upright, and when the forces come down, they're coming straight down through that pelvic floor and really putting a demand on those muscles. Versus if we have that forward lean, when the forces come down, instead, they're going to be coming down on this pubic bone, and it takes a lot of the effort away from the muscles. So a couple ways that we can encourage that forward lean are to shorten our steps. So when we're running, don't try to be reaching out as far as you can. Instead, try to take shorter steps, and maybe you just increase the turnover rate of your stepping. So it doesn't mean that you're running faster per se, it just means that you're picking your legs up at a faster pace. And trying to land, instead of landing with a really hard heel strike, where you're landing more on the middle or the ball of your foot up towards those toes. So if you can think when you're making contact with the ground, if you're thinking about already doing that push off, that's going to help encourage more of that midfoot or forefoot, what we think of as the ball of our foot, landing on that instead. And that also decreases the forces that the pelvic floor is having to manage upon that point of contact. And they do generally recommend that we run at 160 to 180 steps per minute. And you can easily Google some songs that are at that pace, so that if you're running to the beat, you're going to be in that ideal stepping rate, or what we refer to as cadence. So those few tips summarized are to try to lean that body forward, shorten your steps, try to land more on the ball of your foot, and try to keep between that 160 to 180 steps per minute. Hope these are helpful, and if you do have these symptoms, please reach out to a pelvic floor therapist or somebody who specializes in running to see what they can do to help you reach your goals.